Hi, I'm Valerie.
And I'm DM.
Welcome to our channel. I think we've all been in this situation where we feel a breast lump and we just go into panic mode. And the first thing you want to do when you do feel a lump in your breast is to consult your doctor. So DM, tell us how this first consultation goes. I'm sure you see a lot of these patients come into your office probably on a daily basis. Walk us through the first consultation.
Okay, so I actually see quite a lot of them, and what happens during the first consultation is that they often they're slightly anxious, and they might forget certain things. So the point of this video is really to give them a little bit of an insight into this first consultation. Now, on the first consultation, I want to get to know my patient. And before addressing the concern for which she comes to see me, I often need to ask her quite a few questions about her past history. One of the first ones I will ask her about is concerning her past breast history. One of the first things I'd like to know is, did she have any biopsies done to her breast? What were the results of these biopsies? Did she have any surgery done to her breast? And what type of surgery and what type of diagnosis was associated with this? The second thing I'd like to know is her past family history. Now, it's important to know that there are family histories that are associated with an increased risk of breast cancer, such as if you've had past family history of breast cancer or past family history of ovarian cancer. And I need to know if it's in your maternal side, your paternal side, who was diagnosed in relation to you, and at what age they were diagnosed.
So whether it's like your aunt,
your sister,
grandmother, whoever it is.
Exactly. Now, if you are postmenopausal, I'd like to know if you've had hormone replacement therapy, what type and for how long, because that can also change the risk of you developing a breast cancer. And the last thing that I want to know is, when was your last breast imaging exam? Mm-hmm. What was the type of imaging exam you had? And what was the result?
Mm-hmm. Now, and I think here, sorry to interrupt, but I think it's important for, whether it's for imaging exams or surgeries, it's so helpful when patients bring their reports to their appointment. Whether, let's say they've had breast implants, it's so useful to see the surgical report, to know what type of implants, what size, where the implants are located, are they behind, in front of the muscle, the result of the last mammogram. Things like this are always really, really helpful for us to get.
It makes our job way easier, and I think it's also a lot less stressful for the patient.
And I think it increases the efficiency of the appointment. Also, yes. It makes our job easier, but I think also for the patient, they will get much more out of their first appointment if they bring us all the information.
Yeah, and sometimes it also allows them to skip a few things, to not have to repeat certain tests. Exactly. Because we don't know what was the result or how long ago, and we're not quite sure, and we just have to repeat them.
Yeah.
So I think if they can, I always ask them to bring the films with them.
Absolutely.
At the first exam. Now, once I have done that, what I want to do is I want to address the concern for which they have been referred. Now, concerning masses, I always have to go through a questionnaire. So I ask the patient, when did it occur? Mm-hmm. How long ago? Is it always there? Does it come? Does it go? Has it increased in size? Has the patient noticed any changes also in her skin, such as dimpling, redness, thickening? Has she noticed any difference between her two breasts? And are they lumps anywhere else in her body? And those are the things that I actually want to know, because without being able to make a diagnosis, it does give us clue as to what it can be. And also, it helps us direct the next investigation.
So I think another important thing you probably want to know about is nipple discharge.
Yeah, so sometimes it's actually the reason for which they come. But if they don't spontaneously tell me about it, I will ask them and make sure that there isn't any, or if there is one, I will ask them, what is the sort of quality of the nipple discharge? Is it in one breast? Is it in both breasts? What color it is, and how long it's been ongoing as well.
Right. Mm-hmm.
And then Once I've finished questioning the patient, I will examine the patient. Now, the physical exam serves two purposes. The first one is to gather information on the lesion, but also it helps me start planning the type of surgery if I think that the patient may need one, because as you know, all breasts are very different.
Right.
And all masses are very different.
Of
and
course.
The same mass in different breasts can lead to different surgeries.
Mm-hmm.
So it's all things that I look for when I examine the patient. Now, the physical exam is an exam that I do both sitting up and lying down, because certain lesions can be better felt in one position than another. So both positions will give your doctor some extra information. When the patient is sitting, I examine both her neck area, so all her lymph node areas that are maybe associated to breast pathology. So your neck, your collarbone, and your armpits. And I also examine the breast. And once the patient is lying down, I re-examine the same areas to see if I can feel anything. And I think after I have gathered all that information, then I will direct the patient towards the investigation that needs to be done. And depending on the results, then we proceed to whatever the treatment needs to be done.
Exactly. Well, thank you, DM. I think that was really helpful information. So hopefully you also found this information useful. Keep in mind that we will leave on our blog a checklist of all the points we discussed in this video today, so that you can use this as a tool to prepare yourself for a first consultation with your doctor. So thank you for watching, and make sure to leave your comments in the section below if you have any questions. We'll see you next time.
Bye.